Hey everybody, hope you're doing well, having a good day. Thank you for all the well wishes. I've received lots of emails and phone calls supporting my current condition and diagnosing my current condition as well. So I appreciate that. Many of the emails diagnosing what I'm going through now make sense. They really do, and hopefully we can figure out what's going on, and hopefully we'll struggle through another conference here and I'll be able to read the data, but I'm pretty good at memorizing it, so we can go from there. Unfortunately, we've lost 4 residents of the community over the last 24 hours. We've lost 2 members of Onondaga County in the hospital and 2 at senior facilities, 84-year-old female, 76-year-old male, and again, 2 members at senior facilities. I'm very sorry for the families of the loved ones, and I'm very sorry for everybody that has been impacted by this pandemic with the loss of life. It's a horrible thing. Our 7-day average continues to move in the right direction, 1.6% today. Really a remarkable turn of events from where we were in January to where we are in February. Again, that's because of all of you and the work that you've done with distancing, avoiding these trap events. Hopefully we can keep this progress going in the right direction. 1.6% is pretty good for wintertime. If we continue to go lower, I'll be surprised, but certainly we're in a much, much, much better spot with this virus than where we were before, and the data will continue to show that. Overall, over 30,293 positive cases since March 16th. That was the day we received our first positive. That's 95 new cases today. Today's Thursday. Thursday, Friday, Saturday are usually the high numbers of the week, so still under 100 for a case for today. That's good. Active cases are down to 1,082. Very good. That's the lowest we've been in a while. So each day we have more recoveries than new cases. That's the right trend to be in. Out of our 95 today, we had 6 senior facility residents. So that's a little bit higher than where we've been. Part of how our cases have gone down, our hospital numbers have gone down, is that the senior facilities themselves, due to the vaccinations, have been producing much less cases, many fewer cases than normal. So hopefully that's just a one-day 6 out of 95, close to 6%, 7%. Hospital numbers are at 108 in the hospital related to COVID. ICU numbers down a little bit since yesterday, 21. Please keep these neighbors in your thoughts and prayers. They're in the ICU because they're having a hard time, so we need to get them home. From a vaccine standpoint, we've now administered 17,585 first doses, and we now have administered 9,809 second doses. Again, for your second dose, look for an email from COVID Vaccinations to give you your appointment time. If you, for whatever reason, did not provide an email when you got your first dose, we'll call you. We got your phone number. And again, common sense, but it's worth repeating. If you received the Moderna vaccine the first time, you need the Moderna vaccine the second time. If you went to the fairgrounds for your first shot, you're going to the fairgrounds for your second shot. War Memorial or On Center Complex, the first shot, you come to the War Memorial or On Center Complex for the second shot. On list, those of you who have signed up for on list, please check your emails every day. On registration days, we ask that you check them a couple times a day as well. You will receive an email from Kinney Drugs if you are pulled. Again, Kinney Drugs pulled from on list this week. We also participated with that. If we don't get, how it works with on list, we pull the names. There's a random selection process. The seniors get an email. If we don't get a response after a period of time, we phone bank to contact the seniors and call after a certain period of time. If we can't get in contact with the seniors, then we pull new names. What we're finding is that many members on list have gone and gotten appointments elsewhere. So then when we know that, we then take them off of the list so that next time they're not in that position. But the system's worked well. There's other communities now doing similar things, so certainly we're pleased with that. Reminder for our first pop-up clinic that we did with People's AME Zion Church. The second shots will be Monday, February 15th at the church. The start time for the clinic will be at 10 a.m. You should look for an email from COVID Vaccinations. Again, if you didn't provide an email, we'll call you. But that was our first pop-up clinic. The second shots are now due. That was almost 3 weeks ago. The on-center clinic for February 15th has been moved to Tuesday, February 16th. Those are second shots. If you had an appointment February 15th, same appointment on February 16th. And again, you can look for an email from COVID Vaccinations for the change, but I just told you what to do as well. So that works out. Next week, we've yet to get our doses for how many doses we're getting for the immunocompromised population. What we're going to do in week 1 is as follows. Right now, Dr. Gupta and her team are working with primary care providers to get a list of the most vulnerable with immunocompromised conditions. We will then vaccinate from that list from the primary care providers at the on-center for week 1. Week 2 will be different, but with every category that we work with, there's your most vulnerable in the category. When we first started doing 1B, when we were doing educators, we worked with school districts to get the names of the educators that have pre-existing conditions, maybe that were working remotely. Let's get them vaccinated first. Why? Because COVID preys on our seniors, and they prey on the members of our community who are immunocompromised. Recognizing that it's going to be a while before we get to every immunocompromised resident, just like it's taking a while before we get to every senior and every educator, every healthcare professional. What we want to do with this first batch is we want to get those immunocompromised residents who, quite frankly, can't leave their homes out of fear of the virus, because if they got it, they would face a very stark consequence. So we're working directly with primary care providers on that list. The primary care providers will most likely let you know when your time slot is, or we will call you with your time slot. We don't know the number. If the number's a big number, we may pivot and change a little bit and then open up registration as well to immunocompromised outside of the referrals in from the primary care providers. But we're assuming the number is not going to be a huge number, so we want to really micro-target the most vulnerable in that population. And who would know that the best? It would be the doctors that serve these people. So for week 1, these individuals will need a note from their doctors. Their doctors are making the referrals, so that won't be an issue. Week 2, again, week 1, I reserve the right as county executive to pivot if we get more vaccine. But week 2, it will be a different process. We may have different points of distribution set up, and certainly it will be broadened. But for week 1, we are going to go this route right now so we can micro-target the most vulnerable. Looking at the symptomatic testing, again, ongov.net/Cayuga Medical, Monday through Friday, 9 to 2. Weekend symptomatic testing at Essentia Health, West Genesee Street, 8 to 12. Again, ongov.net/Cayuga Medical. Asymptomatic testing, again, we're doing community sites. I think this is a big part of the reason why we've turned things around is people getting tested and taking advantage of it. Today we're at East Syracuse Village Hall and Onondaga Town Hall. Tomorrow, Lafayette Community Center. Next Tuesday, we are at the Northeast Community Center and the Cicero American Legion. Next Wednesday, Fayetteville Village Hall, Town of Clay Senior Center. Next Thursday, we're back at Onondaga Town Hall, and next Friday, back in Lafayette Community Center. So please take advantage of this. We're doing this because we want to find the virus, find hidden pockets, isolate it. So please take advantage of that. One of the positive developments from the last stimulus package was the recognition that we have many people who rent that have fallen behind on rent due to COVID, and we have many landlords, specifically our smaller landlords that own multiple small unit properties that haven't been getting paid and are having a hard time paying their mortgage, paying their taxes. This creates a real problem if you think about it. A renter loses their job related to COVID, can't pay rent. The landlord lives off of this income. This is what they do. They can't make their mortgage payment or pay their taxes. What do they then do? They then sell. And who's buying in the market? You've all reported on stories related to out-of-town speculators. This hurts the housing market. It hurts everything. We received money in from the Treasury, about a little over $13 million to help address this issue. We really need to get our hands on the best way to address this. So we have a survey on our website that we're asking landlords to go to fill out, so we can try to really develop this program to meet the needs in the community, so that these renters can get their rents caught up, the landlords can get paid so they can pay their bills. So we have $13 million for this program. It will probably go fast, but we need to develop the program, so we're asking for feedback from the landlords. Please go to ongov.net, participate in it, so that we have an idea about how bad this problem really is in our community, so we can develop a program to address it and address it quickly. Saying that, happy to take questions.
You're saying that you're going to require a note from a primary care doctor. Can you take us through how that process will work of the county getting the primary care doctor's note, or will somebody have to bring it, or how does the process work?
So week one will be easy, okay? Because what we're doing is, again, all immunocompromised individuals, I can speak to being compromised right now. I can barely see you. It's very serious, right? So, but we do know that there's types of residents that are transplant recipients, others who have severe circumstances that they need this shot. It's a life or death situation. We want to get them first, okay? So for this is very easy. Instead of me trying to go figure out who you are and how many there are of you, I'm going and we're talking to the doctors saying, who are your patients that are falling under these circumstances? Give us their names and give us a letter confirming they are who they say they are. So week one's going to be easy. Week two, we're going to work on obviously a doctor's note. Many of the doctor's offices have, I think it's called MedEnd. It's a software system where they can produce letters. They don't need to sign them all. If it comes from MedEnd, we know that it's real. In addition to that, we're looking at verification, whether it's Social Security disability verification, Medicare disability verification information we can use. And we're working on an attestation that Dr. Gupta is comfortable with. If you notice, the state said you can attest, but there will also be an audit, right? So who gets audited? We do. So we have to figure out how we can have an attestation system where we have good data and we can feel good about the attestation system. So we want to make this easy for people because in week one, we don't think this is going to be, we think our approach of getting our most vulnerable out of the immunocompromised done first won't require these extra steps. It will work. Week two, hopefully we'll have a attestation system. We'll know specifically what other verifications besides the doctor's note you can get. But the doctors have told us they can produce these and produce lots of these. So obviously that's the best, right? A doctor's know the best. For some reason, if somebody's doctor won't give them a note, or can't because there's too many people asking, then we go to the other forms of verification, maybe even including prescription information or whatnot, or pharmacy information. So we're working through that. The attestation is kind of the answer to all of it, but we're going to be audited by the state, it looks like. So we have to be very careful with how we create that process, and we won't need it in week 1.
So people aren't going to need to, so with this technology, people aren't going to need to show up with a literal note in their hands in week 1 anyway.
Week 1, the doctors will get it to them, and then they'll bring it. So we do need to know that you are who you say you are, and here's your evidence. But it's a little bit easier because the referrals are coming in from the doctor's office in week 1.
And just scheduling, how will that work?
We will work, just like sometimes we'll get 1,200 doses, only a certain number go out to the public. That's because we worked with specific groups on pre-registration. So this will be a pre-registration process.
Where will those vaccinations happen? If these are sick people?
Week 1, it will be at the on-center.
So very sick people are okay coming to the on-center?
Absolutely.
If there's walking issues, waiting in line issues, I mean, we're talking about the sickest people.
We've been vaccinating people with immunocompromised conditions who are over 65 for weeks now. So if you have certain issues, we have wheelchairs. We have people here to help you, get you through it. Obviously, there's screening that's taking place related to symptoms, and there's distancing involved and whatnot. So it's a big room, as you all can look at. There's no perfect way to avoid all risk, but we have been vaccinating immune-compromised people over 65 for weeks now.
Ryan, there have been a lot of questions from people who are homebound, though, whose disabilities really prevent them from going out. At some point, will there be a program to get to them in their homes?
There will. The homebound population right now, I understand, we hear from everyone. We understand it. We have different plans that we put forward to the state with our vaccination plans in the beginning. It's really a supply issue right now, Tim. Again, you're from a timing, and if you're only getting a certain amount of supply, you don't destroy your infrastructure that moves. Speed is our friend when it comes to getting shots in arms still. Once we get more supply, or more supply comes into the market and other distribution networks are taking care of other populations, I know that we're going to be the ones in the local health departments that are going to be leaned on to handle the hardest groups. We already are, right? So they already ask us to do pop-up clinics in underserved communities. They ask us to work with our members of the community that have developmental disabilities. They're immunocompromised, asking us to work with these populations because we're good at it. And we'll get to the homebound seniors. We'll get to homebound members of the community that are immune-compromised. We just need some more vaccine to get to that point.
You can blame me for having too high of expectations, but it sounded like on Tuesday that leading to today there was going to be perhaps a bigger plan unveiled that talked maybe longer term. What's the status of what you do week 2, week 3? I realize it's all contingent on supply.
Yeah. So it really, week 2 could be us. It could be we bring on other distribution partners, right? It really depends on the supply, and so we've talked about that. We've talked about, do we have primary care doctors potentially vaccinating as well at their offices? Certainly that could be part of it in week 2. But right now, it's about speed. And if I knew today that I was getting a certain number of shots next week for this population, I might pivot. Again, if I think I'm getting more vaccine than I am, I'm probably going to pivot, and we'll probably activate some of those other distribution channels earlier. Again, I'm under the assumption we're going to get a modest number of vaccine. If we get a modest number, the most efficient and quickest way to do it is to utilize the infrastructure we have.
Are you asking these doctors when they submit names to pick the most vulnerable of their patient population?
Yep.
And
They know their patients, right? Right. We don't. So That's what we're going to focus in on.
And are you in touch with every doctor in the county? Is that even possible?
Our health department, there's you have the Onondaga Medical Society, you have all the various associations, so that's something that Dr. Gupta and her team work through with them.
But there's got to be doctors outside of that network who might have patients as vulnerable who need the vaccine. There might be doctors for people in fringe county neighborhoods that cross the border into other counties. How do you get to those people, or is that not the focus of week one?
No, well, I think week one we're not going to get to everybody, just like we won't in week 2 and week 3 and week 4. It's going to take a long time. So we're going to get to the way I've learned and the way this vaccine rolls out, Andrew, is you have to, you can be upset with the realities of the ground that we probably now have close to 100,000 people that are eligible. If you look at a long list of immunocompromised, right? And we're not going to have even close to that vaccine, so we can get frustrated by it, or we can realize that we're going to get to a certain number of people that need the vaccine, and we're going to micro-target the best way we can to preserve life, and recognizing that still won't be good enough, especially in the first few weeks.
You mentioned, I'm sorry, go ahead.
Is Dr. Gupta, you and the rest of the doctors kind of hand-picking the first few hundred people, or is it going to be more of a raffle style like that?
No, Dr. Gupta is going to go and determine the certain comorbidities that are really important, and Dr. Gupta is here too, that are what we believe our criteria should be for the certain comorbidities that are most prone to the worst outcomes. And then we'll work with the primary care networks to develop a list based off of the number of slots we have. That list will be full, recognizing we will not have enough slots to meet that full list in week 1. We then go into week 2, and we continue to, whether or not we do things a little bit differently will be depending on vaccine and where we all stand on that.
Is there a specific list of pre-existing conditions? I know you mentioned one of them, transplant recipients, but is there specific conditions that will be prioritized?
Dr. Gupta will determine that list and work with the primary care doctors on it. I haven't seen it yet.
That list has not
Not
been
that I
created yet?
could see it well if it was in front of me either, but I have not seen it yet. But we can, I'm not going to box in Dr. Gupta and her team.
We have heard from people who've heard from their doctors that there is a narrowing of the comorbidities list by the county. It sounds like that's true, that you're prioritizing among the state's broad list who you want vaccinated first.
Correct. Yep.
And will that be the same for week 2, or will it be broad?
It really depends on what it is, right? So we're going off of, and again, I wish if we were it's easier to talk specific to the data and all this if we were the only ones giving out shots. Remember, many of your seniors are immunocompromised, right? And so thousands of seniors have been vaccinated. What the immunocompromised population that hasn't had an opportunity are the under 65s. And so we just don't know who's been vaccinated, who hasn't. We don't control the data. We control our pod. That's it. So, but yes, we are, Dr. Gupta and her team are narrowing so that we can get to those who are most vulnerable out of a vulnerable population. And then recognizing we won't get to everybody in week 1 and week 2 or week 3, depending on where the distribution is, unless we get a lot of vaccine that I don't anticipate we will.
Can we ask Dr. Gupta about that list?
Dr. Gupta can come up in a minute, yes.
I've also heard from some people that they've called their doctor's offices asking for some sort of medical record proving eligibility, and the doctor's offices have said no, because we're waiting on more guidance from the county as to what we can give you. And this question came up Tuesday, and it seemed kind of mysterious, but I've heard from people that this is the case. What would you say to doctor's offices if people ask for their own medical records?
Wow, look at, I'm not a doctor, but I would assume if I ask for my medical records and the doctor says no, I will have a problem with that. I'll look for a new doctor. But we made it very clear on Tuesday that a doctor's note was an eligible form if you're immunocompromised to get the vaccine. So that's I don't know, you're hearing from a lot of people obviously these days, but that one right there makes no sense to me. We made it very clear. A doctor's note gets you a vaccine shot.
I'll rebuttal with you. We are hearing from a lot of people on
I believe you. Dr. Gupta, do you want to come up and talk?
So yes, there is a lot of confusion about how these immunocompromised category or chronic condition category, what you call it. If you look at anybody who is over 65, a lot of people have comorbidities. That's the word which we use. It means you could have diabetes, hypertension, obesity, and then complication of diabetes, cancer. So from point of view is that what are the specific things when the governor put it out there? Think of the simple way to think of that any organ system can have a disease, whether you're talking about heart, lungs, right, kidney, stomach, your musculoskeletal system, your blood, all these things. So anything which can result in some sort of a disease in the body, whether you're young or old, can result in some sort of a treatment. That's where it qualifies you to have what we call comorbid condition. So 40-year-old person could be very morbidly obese, could have because of that, could have high blood pressure, diabetes, and complication. Diabetes will be diabetic nephropathy, we call it, kidney problem, eye problem, and nerve problem. You have a 70-year-old person who have hypertension, who may not be obese, but because of hypertension have a now stroke or have some other disability because of that. So all these things is sort of a complex maze. A physician is the one which is the best person who can justify that if I have, let's say, 10,000 patients, who am I going to prioritize in the list right now? So these are the conversation I'm having with my colleagues in the community who have large practices, and they are all in different areas. That how can you create sort of a algorithm in a way? I mean, they all have electronic medical record of different kind, and you just put certain variables there. There's no restrictions for the age, so it could be older, it could be younger, but we want to get those individuals, as County Executive mentioned, who are the most sick and vulnerable. Sick doesn't mean they're sick right now, when you were mentioning at that time. When they get the vaccine, they should be stable, what we call it. They should be in medical equilibrium position. It means they are able to get the vaccine and they're able to safely come to our on-center, right? So we are looking for that if either they can go by age or they can pick from somewhere who has the multiple diagnoses. And they are the one who are going to give in the week one that these are our first 50 people or 100 people that we say that we are attesting that these individuals have chronic medical conditions. We don't need to know what they are because we want to protect their privacy. That makes our life easier. That makes doctors' life easier. And that's attestation comes from the physician office now. Now we have a group of people. They are going through our clinic, and we can vaccinate them. That's the goal for the week one. As we go into the further week 2 and week 3, we don't know what the plan will be, how the distribution will be, whether we'll get the vaccine, whether our doctors will get the vaccine. But the goal will be to work collaboratively together with all of us, right? So hopefully that answered some of your questions.
So you might not even produce a list of conditions to give doctors. You'll tell the doctors the general categories, and they'll come to you with, in their opinion, who needs it first.
So yes, so we are working jointly together. It's called collaboration, right? So as a public health, as a commissioner, I want to see that most vulnerable are the one who they are going to be picked. What are your categories, right? So my question is to them, what are your categories? Can we come into an agreement with that? Because they know their patient population, what seems, and as a clinician, I can see that it does make sense. So it's a very good brainstorming which we work together and try to identify so everybody can follow the same sort of a format. So that makes their life easier when they are vaccinating in their own offices, right, in their clinics, when they are doing, if they are going to do clinic if they get vaccine? Can they vaccinate 100 to 300 people? What are the priority they are going to take it? And that will be something based on public health guidance, which came out from the governor's office at this point. If you go to the what eligibility criteria he put it out as cancer, chronic disease, pulmonary disease, intellectual, developmental disabilities, heart conditions, immunocompromised system, organ transplant, right? Severe obesity, sickle cell disease, that's a blood, type 1 and type 2 diabetes, and cerebrovascular accidents, what we call, and the liver disease. So what I gave you, think of every organ system. If there's a disease in that organ, that multiple organ system disease puts you in the higher list, because if you get COVID, you will have much severe negative consequences than if you have, not to kind of, belittle it, but it's if somebody has just a plain hypertension versus somebody has 3 or 4 or 5 diagnoses. So that's how the physicians are trying to protect their patients. They are working alongside, and it's a great partnership, and it's evolving as we are going into further, next weeks. But you have to be. I think I can reassure the community, as County Executive mentioned, in last several weeks, as the seniors for qualified for different reasons, they have multiple comorbid conditions. So it's not that we have not done so. This category sort of opens up door for those who may not have qualified, being an essential worker, or being in somewhat older population who are essential worker, all those. So now we are trying to capture those who are not captured anywhere.
Do you know how many additional people that is?
It's kind of very hard to figure it out, because we go by how many people have obesity in our community, right? If you take a broader category, it's like 122,000 people. If you do some calculation, how many people in transplant? A little bit over 1,000 maybe. We don't have exact data in that either. We have a lot of people with diabetes. That, again, goes into the percentage population and how they're distributed throughout the different practices. That's the challenge for each practice. So let's say if you have a large practice of multiple physicians, and if they have, I'm kind of throwing it out, they have 60 or 70,000 patients, how many of their patient population have this underlying problem? Which they can actually, because of electronic data, they can produce a report of that and then pick from there. So it is a good. It's something they are looking into that. They are working as I speak. I have several conversations in last few weeks with them, and I'll continue to have that as we get the assignment allocation at this weekend. That goes back in that how many people we are going to ask them to give it to us.
And about the doctor's note, did you say that they just need a note that says you qualify versus you have these 5 things, because you said the county doesn't necessarily?
Right. So, it's something, because these physicians, if they are putting, as a clinician, if I'm testifying for something, it means I'm putting my license right there, right? So I am professionally liable for something which I'm not going to say, which is untrue. So any physician, he or she is going to put it that based on the New York State Department of Health guidelines, this person is eligible to receive vaccine for, this is something they can put as sort of a general language, which covers what the governor is asking us, the Department of Health is asking, and that also, that gives us permission to vaccinate this person, because we are trusting this physician has the medical record. If we get audited, we'll go back to the physician who will get audited. If anybody has not followed that, that is not going to be that was going to be unprofessional. So
if the doctors choose, 5,000 priority patients this week to get vaccinated, and you get 300 doses,
right?
How are you going to prioritize them yourselves if you don't have the diagnosis?
So we don't. So this is something we are going to ask them to give us that many. They know their patient, who's the most complex patient in there, who has 5. We give them a number, right? We give them a number and say, we have allocation for that many patients for you because of the size of your practice. How many, so you give us these patients, and they are going to give based on how many comorbid condition. That's the word we use, a comorbid. It means there are more than one. You don't have any hypertension. So the people who have only hypertension shouldn't expect that, right? I mean, I don't want to make them uncomfortable right now, but if they are essential worker, if you think of that, how many people in Onondaga County probably have hypertension? A lot of them. Younger people, like 50s and all that, people can have hypertension. We live in a stressful life nowadays. So we certainly get into hypertension is a very general, broad category. But when you have other things along somebody who have a cancer, who have diabetes, now you have complication because of diabetes, that makes you into the higher category and then gets into that list at this point. And rest assured, with time, as county executive continues to remind everybody, and I'm pretty much echoing his word, we will have, as with the vaccine continues to come in our community, everybody will get the vaccine. We have more vaccines will become available in the future. We may have AstraZeneca and Johnson & Johnson. There will be more opportunities for people to actually get vaccinated. In the meantime, when everybody is waiting for the vaccine, masks are so lifesavers for us. Even after the vaccine, I will just take a few minutes to say that you have to wear your mask. You really need to make sure. I'm sure you've heard about the double masking and all those. You have to wear your mask. That is so crucial to protect our community. You have to stay home if you're sick, and hand washing, that goes along. So all these things are so crucial and continue to protect yourself, your family, your coworkers, your community. So I'm asking everybody to remember when they are getting vaccine, they're waiting in line. This is something, it's a civic duty at this point to protect yourself and to your rest of the community.
Dr. Gupta, the New York State today said they'll no longer require fully vaccinated people
Yep.
to quarantine if they were exposed.
Yep.
Can you tell us how you as the health department feel about that?
Yep. So I just got that press release report just before I came in here. And we certainly are going to implement that because COVID-19, we were waiting for CDC guidance. CDC, as soon as CDC put that forward, then governor adopted it, and then State Department of Health adopted it. And if you look into the language, it pretty much follows the same line, that if somebody is asymptomatic, has been vaccinated, got both doses, and in 2 weeks has passed, that does not need to be quarantined. So we follow the state guidelines and we implement that as it becomes available to us. So we will follow those footsteps essentially and then after 90 days, so it goes up to 90 days because we follow the same thing if somebody has gotten sick from COVID-19. Like up to 90 days, that becomes a little bit of it can protect for 90 days. And that's what CDC has said. That's what the State Department of Health said.
Just a quick follow-up. Does that include people who are fully vaccinated, the 90 days is up, and travel state to state?
So travel thing, which we have to go back again to state because that has not been clarified yet. Again, we cannot be less restrictive than the state. If the CDC comes and then as soon as it's adopted by the state, we run with it because we are following the science, we are following the data, and the travel part has been still, and I would think it will follow through, but we are going to get clarification from the state for that.
And there's no concern for you as a doctor of asymptomatic spread of people who have been vaccinated. You can still be a carrier, is that correct?
Well, so the vaccine should protect. At this point, if you look at the language which came out from the state, it says, continue to wear mask. It's something is that we are going to pretty much, including those, all New Yorkers, including those who have been fully vaccinated, should continue to wear masks, social distance, and be smart until herd immunity is reached and pandemic is fully integrated in the history books. That is a very important statement in a way that we really want to make sure that even though we are vaccinated, we really need to make sure that we are our mask, a good mask. And if you look into the CDC guidance, which just got updated, and we are reminding everybody having a fit mask is very important, not like showing your nose and mouth and pulling it down when you're talking. Put a very good way of wearing the mask will be very important in disseminating the transmission of virus. To your question, when you say that we don't know that data yet at this point, and in the lack of the data, that's why all these mask wearing, physical distancing, social distancing are very crucial to prevent any transmission of virus.
I may have missed this, but are we only confident that the vaccine is effective for 90 days? Is that why?
Yeah, we don't know that at this point because that is so 90 days is based on the clinical disease at this point. Because as you know, Tim, this is an emergency use authorization of the vaccine. As we are speaking, the data has continued to be collected from the study. So as we continue to receive the data, how long the immunity lasts, that will be something we'll continue to update. So for now, we are just going by the disease and kind of pretty much parallel in terms of the force in terms of making that some generic generalization for the vaccine also, that at least for this time frame will be active because that's what they have data for. As we go into future, we'll continue to get more. I'm hoping at least for a year. I'm hoping for longer, but at least for a year will be the one because it goes into the seasonal. Will we get seasonal vaccine? We don't know that yet. So we will learn, and then you will learn along with us.
If someone feels they should be vaccinated next week, that they have comorbidities enough to be on the list next week, should they have that conversation with their doctor?
Yes. I mean, these are the physicians are at the forefront, the primary care physicians are, anyone specialty physicians are the best people they communicate. Yes, I know everybody wants to do that, but sometimes giving somebody a little bit way ahead to protect them it's kind of hard, but that's something we ask everybody to be patient. Everybody will get their turn, but those who can be the sickest one and as county executive announces death every day, every other day or something, those are the one which we want to target, at least who have multiple comorbid conditions, that you can protect them by vaccinating first in a row. That will be our goal, and that's what primary care physician, they have a tough road ahead because all patients are going to ask them, me first, and how do you pick this person over that? There's no personal selection. They have to go by their data. They have to go by how they can protect their most vulnerable.
Do you expect that to be the status for week 2? Do you think there will be enough people in that most critical group?
Oh yeah, that will go for on weeks, and I do believe that we have, especially when we are talking about over 65, those have been vaccinated. The state side has been vaccinated at the Kinney's, and then some in ours also. That it has at least given some opportunity to vaccinate those who are very vulnerable. As we continue to do that, we have vaccinated, I think, 55,000. That was the other day. From our county, it was about 27,000 or so. For the first doses, I think was 17,000. Second dose is about almost 10,000. So as we are going in more, but this is only our data. Hospitals have vaccinated, other places have vaccinated. So as we are going more and more, I hope, and I don't have exact data to get that, but as the physician get involved, we'll be able to have a little bit more clarity in identifying that, okay, from this practice, that many, if we continue to get data, how many percentage of their people got vaccinated. And as you remember, a lot of times people go to the doctors, if they're 50% population, and I'm just picking up a random number, a lot of people just want to establish. If you're healthy, you want to establish with the doctor. You don't see the doctor otherwise unless you have a problem. The people who come every 3 months, every 1 month, every 6 months have some sort of an underlying problem. That's how you can target them, right? So those are the one which we want to see. What percentage of your patient population is this? And that's data scattered all over, and we're just trying to get hold of that at this point.
A similar question that I asked the county executive, because the county pod will be somewhat selective on which comorbidity groups to vaccinate first, for the other people who might want to go to the fairgrounds because it'll be broader, are doctors able to give proof to their patients that they fit this comorbidity group of vaccine?
So I would say rectify that a little bit, that we will use the same state guidance which the state has provided, and then same will be for anybody is using. So it's the same guidance.
But you're broadening it.
What do you mean by broadening?
Your pod is a stricter categorization than just hypertension. Someone with hypertension can go get a state-run vaccine.
Yeah, no, we don't say no. It's just something selection, the physicians are doing it. So we are not selecting people that way, that because they are in there. What we are trying to find out is that who is the most vulnerable. And that will be, we are depending on the physicians to give us. If somebody comes in with a hypertension, we are not going to say no to them. That's not the point. I think that's not.
We're
Yeah.
micro-targeting it.
That's
Yeah.
what I'm saying. I just want to be
So-
clear, though, for people for the doctor's offices telling patients, we're waiting for the county's guidance on what to give our patients, but they want something to go to the state fairgrounds to be vaccinated. Those doctors should be giving them what they ask for.
Yeah, well, the state fairground site's run by the state. They put out what their accepted guidance is. So that's all set.
But we're hearing from Onondaga County doctors who aren't giving their patients proof of eligibility pending guidance from Onondaga County on what to provide.
Yeah, for our pod, I mean, they aren't paying attention, Andrew. I mean, we went through this again, so let's go through this again. So the state runs the state fairgrounds. We help staff it. The New York State said for their sites, this is what what they will accept as forms of verification, identification, whatever you want to say it. They've already said that. For our site at our pod, with the distribution of vaccine we're getting for week 1, we're not getting, we are getting the clients directly from the doctors. So we're getting the most vulnerable of the vulnerable from the doctors, and they're giving them to us. And so they're attesting for them, and they should provide them a note as well. And that's what we're doing week 1. So
All that makes sense. I've heard all. I
yes.
get
So
that.
but I guess your doctors you're hearing from. So my frustration isn't with you; it's with the doctors. The state sets the rules for the state sites. We week 1, they probably have been in some sort of contact with us, and they know that they got to come up with the most vulnerable list based off of the criteria Dr. Gupta is talking to them with. So moving forward in week 2, they might be doing vaccinations themselves. If we get a list of vaccine and we say we want to go, these 3 practices can vaccinate 100 in a day. Okay, you have to do it in 1 day because we do things quickly around here. Here you go. And then the same criteria is set. So the same criteria that we've set, the state's given local governments the ability to have different criteria from that. The one thing we haven't done is we don't have Onondaga County attestation language set for someone who has a condition to come sign today, because that won't be necessary. Because in week 1, the doctors are going to tell us who their most vulnerable patients are in the community, and that's who we're going to vaccinate first.
I'm going to try one more time. So if someone is looking to sign up at the state fairgrounds starting Sunday,
Good luck. The
right,
appointments.
sure.
The appointments are good luck. I
Right.
mean, yeah,
But
they follow the state guidance.
you're going to have a lot of people trying Sunday, and they want a document in their hand from their doctor to show
Yeah.
proof when they show up. Those doctors should be giving them something.
Absolutely. Well, yeah. I don't know why the doctors would never not give a doctor's note to the. I mean, I don't. Again, that makes no sense to me.
That
But-
is what's happening, though.
Yeah,
That's why I bring it up.
Yeah. So that absolutely the doctor should give. If a patient is asking for a doctor's note to verify that they have one of the conditions that the state has put out, why wouldn't they do that?
Are you saying triple now after our conversation?
No. Actually, you might have just cured me, Andrew. Yeah. So that just joking.
Ryan, can I ask more about the rental assistance
Sure.
program? So does that money come from the most recent federal stimulus bill?
It did. So it came from the last stimulus bill at the end of 2020, and again, I think we received about a little over $13 million, Tim, for our county to go and address the housing issues that are happening. As we all know, there's moratoriums on evictions, and so what we need to do is we need to get a better idea how big the problem is, so that the money gets targeted and focused in a way that helps the landlords, but at the same time, we're not having tenants put into a situation where they're staring down eviction shortly thereafter the money gets dispersed. So
Is the I'm not sure how much of this is at the county's discretion, but will the money go directly to landlords?
correct. It will go directly to landlords.
And is every county getting money? Does the city?
Every county did get money.
Okay.
Yeah, some counties got it direct if you have population over, I think, 200,000. Under 200,000, the state got it. But we got it direct. We love getting direct funding from the federal government. It's a good model. It guarantees the money actually gets spent in Onondaga County, unlike the CARES Act. So this will help us get directly to our residents' situations with housing.
And you are not now taking applications for the money?
We are not. We're taking surveys so that we can develop the program, whether or not we provide 3 months worth of back rent, 6 months, 9 months. These are all things we're trying to understand so that we can be most effective to address the issue.
And if I missed this about that, I apologize. This will forgive the back rent, correct? This is not just to make the landlords whole. This will
correct.
forgive the back rent.
Correct. So if you say you worked at a restaurant in an orange zone and you couldn't work for shut down for 3 months or so, you were impacted by COVID, right? So you get behind on your rent 2-3 months. You would then qualify for this. The check would then go to the landlord. That covers that period of time. Moving forward, you're back to work. You're responsible for your rent.
What's your expectation of the time frame for when you will have it designed and ready for application?
Yeah, hopefully, what are we at now today, February 11th? Hopefully in the next few weeks we'll have we'll get enough data to, we do this anyways, we're in this kind of business anyways, with assistance and rental assistance. So we want to develop a program that has enough flexibility to make sure that these tenants, but also these landlords who aren't don't own thousands of units, they own tens of dozens of units, that it works for them, so that they're not off having a fire sale on their property to get money to pay for their families. So hopefully in the next couple of weeks we'll be able to put together the program and then get the money out the door.
Is this the first program where the money's been targeted directly to landlords? I think in the rental assistance before now has gone to tenants, hasn't it?
We have rental assistance that goes to landlords as well each month, if they qualify through the county. And then even with your Section 8 assistance, that typically goes directly to landlords as well. That way they know the money's getting to the landlord for the rent, and it's documented.
But there's been previous stimulus money too, right, during the pandemic?
There that has had various rules on it, and some of that money I think still sitting there, if I'm correct, waiting through some of the rules, because it was based off of evictions, and the evictions have been halted. So it's kind of a regulatory mess. This money came from the Treasury, not from HUD. So right now it looks like there's a lot of flexibility with it.
Switching gears a little bit more, have you had any further conversations with SU and getting people into the Care Dome?
Yeah, so the Dome, I think, what did the governor say, the 23rd can open up. So I think they're going to open it up probably the next games after that for, I believe, students. I don't know if their plans changed since what we were pitching, but I think there's a couple basketball games after that. And then I think more in the springtime with the lacrosse teams. Both lacrosse teams are going to be excellent. I think their model will be maybe that's when you open it up to the public, as you have the whole dome to utilize to space people out.
Students are still being tested, so it makes it a
Correct.
pretty easy setup there.
It is. So they're testing weekly. They'll probably even remember the rule. I think 72 hours PCR test. Syracuse University has its own PCR lab now, so they could probably even do it within that time period and get it back within the 24-hour period of time. That will be a challenge for other venues, though. With the PCR test, it's not a rapid test. 72 hours turn times. It will be interesting to see how these professional operations can make this business model work.
How does something like that, I know we're still a few months away, but impact the amphitheater, which doesn't quite meet the threshold of assigned seats, but...
Yeah, so they didn't touch on outdoor venues yet. We anticipate that they will. Again, the amphitheater, 17 to 20,000 capacity. In the shed, you got about 6,000 under the roof. So certainly we would like to see a season. Again, a couple things. Your advantage are your outdoors. We could do the same types of distancing. Trish, you've probably been there. It's wonderful. You get a great breeze there. And so it's better circumstance and safety conditions with this virus. The other thing that will be in our advantage is that season's going to be in the late summer, early fall. So at that time, confidently, we will have hopefully vaccinated over half of our population, if not the 70 to 80% you need for herd immunity. So hopefully we're pushing the state to get guidance out soon so that we can start to plan, and then Live Nation can go and book events, even if they're limited. Live Nation then needs to make the call on if we're at 20% capacity for the venue, can they make the model work, the business model work to have the concerts? We probably think they can. Other questions?